Hey everyone, it's Dr. Sam, and thanks for joining me today on my YouTube channel. If you like my content, hit the subscribe button and make sure the notification bell so you can always be up to date on my content. So today I'm going to take a question on a condition called Sjögren's syndrome. This syndrome was first discovered by a Dr. Henrik Sjögren in 1933. He was a Swedish ophthalmologist, and he found that this particular condition affects the fluid producing areas in our glands and organs. So this is an autoimmune disease. It's really systemically based, but it really affects our eyes. It creates a dry eye, dry mouth. It can affect the thyroid, the liver, the kidney, the digestive system, our salivary glands. So this affects the immune system cells, specifically the B and T lymphocytes, and they infiltrate different parts of the body and they create an inflammatory response that creates a drying out of most of the mucous membranes in our entire body, but it really affects the eyes profoundly. Aside from dry eyes, blurred vision, it can also affect the joints. So it's been associated with rheumatoid arthritis, and it could create a lot of pain and inflammation, chronic fatigue in our body. And it's a really difficult disease to manage. So I'm going to offer a complementary approach on how to reduce some of the symptoms of Sjögren's. First of all, I would recommend some eye drops that are natural, and these would be either the Optique homeopathic eye drops. I would use those 2 to 4 times a day, and then I would also use the 5% MSM drops 2 to 4 times a day. The key during the day is to keep your eyes hydrated. If you're on screen time, I would make sure you're using blue blocking filters, take frequent breaks, because using any screens are going to dry your eyes out even more. Now in the evening, I like using a castor oil eye massage. This is a light massage on the eyelids. You can also do something like an eye bright tea compress over the eyelids. So you want to keep the eyes moist during the day and in the evening, and this will reduce some of the inflammatory response that's going on. You know, one of the keys with Sjögren's is that the tears evaporate very quickly on the cornea, and so you have to keep hydrating, but I like to use tears that are therapeutic. So these are eye drops that are more than just a Band-Aid approach. Now, systemically, I recommend 2,000 to 3,000 milligrams of omega-3 daily. I also recommend vitamin D3. You might get a blood test on that and then work with your physician, but vitamin D3 is another important support. You could also do some evening primrose oil. That could be helpful as well. Some other things that I would suggest would be green tea extract, vitamin A, and make sure you're taking zinc with vitamin A because the zinc helps in the absorption of vitamin A. Things like bilberry, lutein, zeaxanthin, astaxanthin. Make sure you're getting enough eye nutrients that feed the eyes. This would be very helpful. I might consider working with a functional medicine doctor and boosting your digestive health, your dietary absorption. You know, our dietary absorption represents about 70% of our immune health. So if you've got Sjögren's disease, you really want to boost your immunity, and this could reduce some of the symptoms systemically. Make sure you're eating an anti-inflammatory diet, reducing your stress, getting enough exercise, getting 30 to 60 minutes of natural sunlight every day, improving your sleep, making sure your endocrine health is working optimally, especially the thyroid and the adrenals. Some other anti-inflammatory agents that are natural would be things like curcumin and resveratrol. And there's a new product that's come on the market that's beneficial for dry eye, which is sea buckthorn. We call it omega-7. So you could look into that as well. So overall, there are some things that you can do on a complementary level besides taking steroids that could benefit your health and your vision. And I want to thank you so much for the question. Take care.